Good afternoon and welcome to all of you. My name is Jane Tawney. I'm a physician assistant emeritus. I'm a member of the Women's Health Center Advisory Committee. The Lisa Stewart Women's Health Center of the Mount Desert Island Hospital is a part of the health centers of the hospital. And Women's Health Center was founded 28 years ago by a diverse group of community members. And we were mandated at that time by the hospital board of trustees. One of the core values of the Women's Health Center at that time, and has always been, is that we always want to offer educational offerings to all the women and people of the community. Today, we're pleased to present the first episode of a three-part series called Menopause, Body, Mind, and Spirit. Today's topic will focus on body, the biological and physical aspects of menopause. And the next presentations are for February 25th and March 31st, which will focus on mind and spirit. I and two other advisory committee members developed the format for this presentation, and that's Linda Robinson and Julie Havener. Linda will be presenting today, and Julie will be fielding questions to us. Julie Havener has been on the Women's Health Center Advisory Committee for 10 years, and she serves women in the Down East area as a licensed midwife. A bit of housekeeping. Everyone is muted, so you can type your questions at the bottom where it says Q&A. And Julie will field those, as I said, and answer them. Questions can be answered after each presentation, and then we will answer questions also at the end. And some of you might have questions that you don't wish to share publicly. Please know that we can answer questions individually, and we will happily follow up with emails afterwards. Let me introduce you to our wonderful panelists. Linda Robinson is a certified nurse midwife. She has worked all over the world delivering babies and caring for women. She was the first nurse midwife on the staff of MDI Hospital and has worked at the Women's Health Center from the first day that it opened its doors in 1993 until 2015. She then worked for Global Health Service Partnership, teaching midwifery at the Kamuzu College of Nursing in Malawi, Africa. She is presently the president of the main affiliate of the American College of Nurse Midwives. And she has a passionate focus on raising awareness on healthcare access for rural women across the United States. Linda Crowell is family nurse practitioner and presently practicing at the Lisa Stewart Women's Health Center. Linda partners with her clients in helping them become involved with their healthcare choices, making changes for the better, one small achievement at a time. And we all know that that's how we achieve health, constantly and one small achievement. Sara Tui is a board certified acupuncturist and herbalist in practice on Mount Desert Island and has been for a number of years. In 2005, Sara founded the 54 Herrick Wellness Collective in Southwest Harbor, a 5-provider complementary healthcare group. She specializes in women's health throughout the life cycle and also has a focus for pre-pregnancy, pregnancy, birth, and postpartum, but has a strong interest in the menopausal years as well. And last but not least is Sheridy Olson, and she is the owner of Destination Health, which is located in Bar Harbor, which is a state-of-the-art wellness facility. She is a certified personal trainer, a licensed massage therapist, an AFAA certified fitness instructor, and a Power Pilates certified instructor. She has a bachelor's degree from the University of Maine in kinesiology and athletic training, and she's worked in this industry for over 20 years. Sheridy is passionate about helping people achieve a balanced approach to healthy living in body, mind, and spirit. She commits herself to creating an environment of healthy energy. Each of these wonderful women will give a short presentation, followed by questions and answers. So let us begin. Linda, you're up.
Great, thank you. Welcome, everybody. I'm going to focus just on what's happening physiologically during this stage of women's lives. I want to just start with a couple definitions. Menopause, the word menopause comes from two Greek words, meno meaning month and pausis meaning to stop. Menopause is actually the definition of one singular event, and that is your final menstrual period. The word perimenopause is the time frame leading up to that one event, the final menstrual period. The perimenopause period can be between anywhere from 6 months to 10 years. This is not a disease, it is a life process. It is a time when the production of ovarian estrogen wanes. It is a constant in every woman's life. However, how we react to this stage of life varies culturally around the world, actually. It is a powerful marker of aging. And since different cultures regard the aged in different lights, it can affect how we view ourselves during this time period. It marks the end of our reproductive life. However, it marks the beginning of a new and very productive stage of women's lives as well. So the main source of our ovarian estrogen production is from the follicles, immature eggs that are present in our ovaries called follicles. From the time we are a 20-week fetus in utero, women have all their eggs in their ovaries. And there are like 6 to 7 million eggs in a 20-week-old female fetus. By the time we're born, that number has already decreased to 1 to 2 million. By the time we reach puberty and have our first period, we have about 300,000 to 400,000 eggs. Over our whole reproductive life, only 400 to 500 of those eggs will reach maturity and be capable of being fertilized. So as the follicles wither and die, our estrogen levels decrease. At age 35, this process accelerates until ovulation stops altogether, which is when we reach menopause, our final period. The average age for this to happen is between 48 and 52. That's a broad average. Can be as young as 35, that would be premature menopause, and as old as 60, even a little older. There's another type of estrogen in our bodies that is produced from our fat cells. That's estrone. Okay, this is less potent than the ovarian estrogen, but it's more consistent throughout our life cycle. At perimenopause, our metabolism starts to slow, and more of our calories that we intake in our diet are stored as fat. That this changes the contour of a woman's body as she reaches menopause. And while we may not like that, it is actually a protective mechanism, and it helps keep a steady production source of this less potent estrogen. There are estrogen receptors throughout our body. And so a decrease in the amount of estrogen that we have affects all of those organs, most notably the brain. It can affect our sense of well-being. It can affect our short-term memory, our decision-making process, and temperature regulation. All of that is from estrogen receptors in our brain. Lots of factors affect how we experience menopause. Age, the age we are when we start to go into perimenopause. The time frame, if women experience a surgical menopause, for instance, from a hysterectomy, a total hysterectomy, adverse symptoms from this time of life can be more severe. Amount of body fat we have, women who have more body fat tend to have fewer uncomfortable symptoms during perimenopause and menopause. Our social setting, our cultural norms, and women's interpretations of what's happening to them at the time, which is why we felt like this was an important presentation just to increase awareness of what's actually going on. I'm going to quickly go through common symptoms experienced by women, and then I'll hand it over to Linda Crowell, who's going to get more into how to deal with the symptoms. So hot flashes. This is the most common symptom of American and European women. It is a sudden sensation of warmth and flushing, most often in head, neck, and chest area. Skin temperature goes up, there's dilation of blood vessels. It lasts between 1 and 5 minutes. Alcohol, stress, heat, and emotional distress can all affect how severe hot flashes are. Night sweats are when these hot flashes happen at night, and these can be very uncomfortable because it can disturb our sleep. Insomnia can result, and if our sleep is disrupted during the phase of sleep that makes us wake feeling rested, it can really affect our life during this time period. Sleep deprivation definitely compounds uncomfortable symptoms. Vaginal changes. The vagina, labia are loaded with estrogen receptors. So as estrogen decreases, those tissues thin. This can lead to dryness, vaginal dryness, burning. It can lead to increased vaginal infections and painful intercourse, which leads into the next symptom is a decreased libido or sex drive. So if sex is painful because of vaginal dryness, it doesn't enhance desire. This is something that can be certainly addressed. But decreased libido at this stage of life is not just a woman's thing. Okay, men experience it as well. And there are lots of psychosocial issues that affect our sex drive as well. Maintaining sexual activity is healthy. It maintains vaginal health. And the more that sexual activity is maintained, the more sex drive is maintained. Urinary changes are also common. The lower third of the bladder and the urethra also loaded with estrogen receptors. And so those tissues weaken. So urinary frequency is more common. And if the muscles weaken, urinary incontinence is also more common. Mood swings are huge during this period. Okay, there are lots of hormonal fluctuations similar to PMS and the postpartum period. Mood swings are most extreme in perimenopause and tend to stabilize as the hormone levels stabilize, which happens after menopause, after we reach menopause. Estrogen is also very influential in endorphin release, which makes us feel good. So other panelists are going to talk more about how to increase endorphins as our estrogen levels decrease. Skin changes. Our skin dries out more as our estrogen decreases, and we also experience more facial hair. And then another biggie is bone changes. So we accumulate bone mass until about age 35. That's when our bone mass peaks. And after that, as our estrogen declines, our bone mass starts to decline too. Bone density starts to decline. White women, Caucasian women, women who are quite thin, women who experience menopause prematurely can definitely experience adverse effects from bone density loss. So those are the major symptoms that are associated with this time period. I'm going to hand it over to Linda Crowell now, and then we'll address specific questions as they come up. Thanks.
Thanks, Linda. That was really helpful. And I just want to reiterate that perimenopause and menopause are natural occurrences in our life. It is not a disease process. And so when we talk about treatment of perimenopause or menopause, we're really talking about treating the symptoms. And so what are some common therapies? The most talked about therapy, I suppose, would be hormone replacement therapy. And that's, people might remember the Women's Health Initiative, the studies that were done with this group of women. And they did study some hormone replacement therapy. And that's the time where that therapy kind of got like a bad rap because, you know, there were some increased incidents of like breast cancers, dementia, things like that. And so it kind of fell out of favor. And then there's been some further research that didn't completely eliminate those risks, but they did find that therapy that was started, hormone replacement therapy that was started later in a woman's life, they seem to have more of those complications related to the therapy. So it's starting to be used a little bit more often now in women of a younger age group. So for someone who is in the perimenopausal phase of life, where they're still having periods, although they might be irregular, and there's still a risk that they can get pregnant. Like we could talk about maybe starting like a low dose combination birth control pill. So that would help prevent pregnancy and maybe treat some of the symptoms that you're having with perimenopause. But, and then for older women who are experiencing like particular symptoms, like most commonly it's hot flashes and vaginal discomfort or urinary symptoms related to decreased estrogen. Possible treatments would be, again, some hormone therapy, but for vaginal dryness and discomfort with intercourse, perhaps using something like Premarin, an estrogen cream vaginally could be helpful. Estrogen containing ring, vaginal ring that you use could be helpful. And hot flashes, you know, sometimes using oral hormone therapy can be helpful too. But there's way more treatments than hormone therapy. And so I'll talk a little bit more about those. So when we're talking about hot flashes, if that's a concern that a woman's having and it's really bothersome and they would like to explore some therapy, there are, they're called selective serotonin reuptake inhibitors. They're antidepressant medications basically that have been found to be helpful for women who are experiencing hot flashes. There are also like a medication which is actually originally for seizure disorders that's called gabapentin, which does show to have some benefit for women who are experiencing hot flashes. There are also like some natural things that you can do to help with your hot flashes. And I'm sure that a lot of women do kind of try this before they even talk to their provider about it, but it's kind of logical things like layering your clothing so that if you're cold, you'll have layers, but if you feel hot, you can start taking off layers. If your hot flashes occur at night, then certainly considering like having a fan that you could use to cool yourself off, those types of things. And this kind of goes without saying, and it will help with all the symptoms of perimenopause and menopause are good nutrition, good sleep, and exercise can definitely help all of those things. But going through like some other treatment options, and again, very much like symptom specific. So we talked a little bit about hot flashes, vaginal dryness. We talked a little bit about using like an estrogen or hormone replacement for that, which is localized estrogen, but also using a vaginal moisturizer like Replens, which is something that you can use daily. Using lubricant when you're sexually active can be beneficial. For women who are having pain with intercourse, talking about, as Linda pointed out, have sex, and that will definitely help keep the vaginal tissues, I don't know if stretched is the right word, so that they don't stenose and become more narrow. If you don't have a partner, certainly masturbating or using a sex toy, such as a dildo or your fingers, can kind of help keep that opening a little bit more open. And then going down to talk about like your loss of bone density. Certainly, again, exercise comes into play here, which is good weight-bearing exercises, weightlifting, using your own weight resistance can be helpful. Any type of pounding activity, so like walking or running would be beneficial. Following a diet that's good with calcium and vitamin D, so kind of looking at your nutrition and seeing if you're getting enough calcium intake. Definitely, I would say most people who live in the north need to take a vitamin D supplement, at least 400 IUs daily, but generally I recommend 1,000 IUs daily. And then talking about the emotional lability associated with perimenopause and menopause, as Linda pointed out, that tends to kind of even out a little bit once you are in the menopausal phase of things. But prior to that, if you're having increased anxiety or depression, certainly, talking to your provider about that, considering counseling, therapy, medications that you could try would be like antidepressants or anxiolytics. And again, good exercise, sleep, and nutrition will help with those symptoms as well. I know, lost my place as to what I was talking about here. Supplements like black cohosh is a common one that comes up. Just talking about that in regards to hot flashes. There has been a little bit of research that supports that use. It might work for some people, but it doesn't have a lot of scientific evidence to say it's super beneficial. Let me see. What else? I kind of lost my place as to symptoms for menopause. Also with bone density loss, thinking about treatment for that, there are medications that women can take and men can take for bone density loss, which is like Fosamax. You can have IV infusions that can help with that as well. Hey, does anybody have like, what did I forget? I was just kind of rambling on there.
I think that, you covered a lot. I mean, let's go to Sara, because she has certainly certain ways of approaching this time in her life as well.
Acupuncture and supplements. Yeah.
Right.
Okay, good.
Sara, you're on.
Yeah, so I was going to talk a little bit about complementary therapies more broadly. I'm an acupuncturist and an herbalist, so that's kind of my specific wheelhouse for how I work with people who are menopausal. Complementary therapies is a really wide umbrella term that includes acupuncture and East Asian medicine, and includes herbs, can include naturopathic care, dietary changes, nutritional and movement-based therapies, Ayurveda, I think, which is the traditional healthcare system in India, has become kind of more popular for working with menopausal symptoms. So complementary therapies are a big umbrella. And when I try to think about, what's the most useful information that I can pass along in just a couple of minutes, I think, because it's such a huge topic, I think just kind of going over some of the benefits of engaging with complementary therapy. The biggest one is that there's a very high level of safety when working with any complementary therapy. When we think about mindfulness, when we think about yoga, when we think about acupuncture and herbs, there aren't really side effects to a lot of these therapies, besides just the fact that you're probably going to feel better. So they're really safe to try, and most of them are really safe long term, which I think is important for people to understand. Another really great thing about complementary therapies is that we can address multiple things all at once. So we can address physical symptoms, we can address mental and emotional concerns, all at the same time. So for instance, when people come to see me for an acupuncture treatment, or they come to see me for herbs, we can sort of tease out all of those different things at once and treat them in one setting, and sometimes even with one herbal formula and within the same acupuncture treatment. And I think that's true for a lot of the other therapies as well. You know, working with Ayurveda or working with yoga, oftentimes these types of therapies help the physical body, and they also benefit mental and emotional well-being as well. Complementary therapy works, especially well-evaluated ones. And one of the ways to, you know, there's sort of two ways that I sort of evaluate complementary therapy. One is historical use. So when we see something that has been used continuously by people for thousands of years, like herbal medicine protocols, like acupuncture, like Ayurveda, like meditation and mindfulness practices that have this sort of many thousands of year consistent use by human beings, we can be reasonably sure that there are things about it that are effective. And then the other way to evaluate whether or not a complementary therapy would be useful is with research. So if something has randomized control trials to back it up, if there's cohort studies, if there's a Cochrane review, if something's been evaluated within Western science and it's been shown to work, there's also, that's also a good way to sort of evaluate if this is potentially something that is going to be helpful. Another thing is that a lot of them are very, very easy to try and easy to employ. And I think Linda spoke to this a little bit. So it's, if you want to see if a little bit of meditation or mindfulness is going to help your hot flashes, it's really easy to do that in your own home and try it out for a period of time to see if it works. There's no harm, if you're waking up at 2 or 3 o'clock in the morning consistently every night, there's no harm in having a little bit of chamomile tea or something like that before bed to see if you can sleep better. There's no harm in, trying some yoga in your living room to sort of keep your soft tissue really healthy and promote good, healthy bones. So a lot of these types of therapies are fairly easy to employ. One of the disadvantages of complementary therapy is that you're often asked to become an active participant it can be an advantage, but there's also, times that they're not quick fixes. They take time and they take consistency and they take oftentimes active participation and sometimes a little bit of work. If there's a movement therapy or a dietary therapy or getting to an acupuncture appointment every week for a little while, or remember to take your herbs, there's active involvement in using them. And one other benefit that I just wanted to touch on, if you work with a complementary care provider, you get care that is highly individualized. And so for myself as an acupuncturist, I could see 10 people in a day who are the same age and the same gender and potentially are all having hot flashes and are, concerned about bone health. So it all sounds like the same thing, but I could see 10 people in that day and I would give 10 completely different treatments and probably give 10 different herbal formulas. And I think Sheridy probably finds that also in the work that she does, where when you sort of start to work with complementary providers, you get care that is incredibly tailored just to you, your physical body, your mental and emotional well-being, the context of your life, the food that you're eating, all of these different things that make you get to be addressed in the context of your therapy. So that's just a little bit that I wanted to say about complementary therapies, and I think I'm going to hand it over to Sheridy.
Hi, thank you. Yeah, I'd like to segue off that a little bit and talk a little bit more within the complementary therapy approach around fitness, movement therapy, and a little bit on nutrition. I get asked a lot from women, a bunch of questions. We all know about the hot flashes, but I'm asked constantly about, why am I gaining weight? Why am I losing muscle? Why do my joints ache? Why don't I have any energy? And it's all connected because it's like a vicious cycle. And so there are things that you can do to help you through diet and exercise combat some of these symptoms of menopause. Most women do gain weight as they age, but it isn't inevitable. So to minimize menopause weight gain, we simply need to step up our activity levels and enjoy a healthy diet and being mindful about the food that we're putting into our body. So as you get older, you might notice that maintaining your usual weight becomes more and more difficult. In fact, most women gain weight around this menopause transition. And you can reverse course if you just simply pay attention and do the things that you need to do. And like Sara said, it's not a quick fix. There's no magic potion. It really is a lifestyle and it's a mindset. So with weight gain around menopause, there's many factors that we've already touched upon, including hormones, the aging process, lifestyle and mindset is a big one, like we said, and then of course, genetics. So something that I'd like to talk a little bit about is how muscle mass diminishes with age and fat increases. Fun, right? It's not exactly what we want. So losing muscle mass actually slows down the rate at which your body burns calories. That is your metabolism. So I'm asked a lot about metabolism. You know, we hear it a lot as we age, our metabolism slows down. It's because you're losing muscle mass. So another factor is if you continue to eat like you've always done and you don't increase your physical activity, you will gain weight. So my grandmother always told me, be careful with what you're eating. You can eat that now and it won't do anything, but it will catch up to you, right? Has everyone heard that? It will catch up to you. Yeah, menopause is when it catches up to you typically. Genetics also play a role, but other factors include lack of exercise, unhealthy eating, and not sleeping. That all contributes to weight gain during menopause. And it does become a vicious cycle. When we don't get enough sleep, you're tired and you don't want to exercise. And then you tend to snack more. So it's all connected. So you really have to address all of those. And I would suggest that you set yourself up for success. You know, really be mindful of setting a good bedtime routine, like not having your devices in your bedroom with you at night so you can get good quality sleep. So you're not awake at 3 o'clock in the morning like some of us. You know, make sure that your life is, you have all the things that you need, like the good food. You know, try to eat organic if you can. Try to eat mostly fruits and vegetables on your plate with a good healthy source of fat and protein. Get rid of the sugar. Sugar can account for 300 unnecessary calories a day in most Americans, in the average American diet. So, you know, just pay attention to those things. Simple dietary changes, like if you're a soda drinker, if you get rid of that, just that soda, just that one thing, you will see a tremendous amount of health benefits just from doing that one thing. So with menopause, as we talked about earlier, bones lose their density. This can increase your risk of bone fractures. Menopausal women are also at a higher risk of osteoporosis. So what are some of the things that you can do to combat that? I would highly suggest that each and every woman out there listening really thinks about adding some weight training into your life. It can be as simple as 2 days a week of adding some weight training. Building muscle is really, really important so that you can burn those calories needed, right? So you're speeding up your metabolism, but it's also going to make you feel strong in your body. You know, we need to be strong for functioning normally throughout our lifestyle. That's called functional fitness. Okay, you want to live with integrity for as long as possible, and don't be scared of the weights. I hear it all the time that women are so scared of bulking up with weight training, and it's just not true. So don't be scared of that. Also, you're going to need to incorporate movement activity each and every day. The minimum amount that you want to incorporate would be about 150 minutes per week. Okay, that's the minimum that you want to incorporate in just basic movement activity, whether that's, you know, just walking, going for a stroll. It's a minimum of 150 minutes, okay? If you're more of an intense exerciser, it could, like if you're a jogger or runner, it can be a minimum of 75 minutes a week. Okay, that's your bare minimum that you want to get in. And then I would also suggest that you schedule that into your life like it's your job. Literally get a planner and schedule that movement time into your daily life like it's a client, like you're getting paid to do it, because you are, you're paying yourself. This is for you. It's your one body that you get to live in, and you will start to feel better if you do that, and you'll be proud of yourself. And that's where the lifestyle change shifts. That's where it becomes part of your life if you make it a habit. Another thing that I would suggest women do before you even get to that perimenopause stage, if you're a sedentary person, start now. The sooner that you start before you get to menopause, the easier time you're going to have when you go through menopause. So if you're sedentary and you're hitting menopause, you're going to have an increased risk of heart disease, high blood pressure, diabetes, and obesity. And then you're going to suffer with chronic things like stiffness and back pain, which nobody enjoys that. So jumping right ahead to some of the things that Linda talked about that we can do for exercise: walking, jogging, yoga, dancing, swimming, biking, weight training. Find something you love. Find something that you're really passionate about, because then you're going to succeed. If you love it and it brings you joy, you're going to do it. I also wanted to talk to you quickly about body fat percentage. I'm not one who really uses a scale. I think weight is just an arbitrary number because we're all different, right? But if you look at like your body fat percentage, women aged 40 to 59, which is that menopause age, a healthy body fat percentage should be between 23 and 33%. If you don't know how to find that percentage, just like Sara said, schedule time with a professional. Invest in that time with yourself for that complementary care so that you can get exactly what you need. And you can find out all of this information, and then you have it and you know how to tackle it. So I also wanted to let you all know, if you are gaining weight, if you're experiencing some weight gain and you're at that menopausal age, that weight is mostly visceral fat. That's a type of fat that you see around the midsection, and it also surrounds all of your organs. So we want to minimize that as much as possible. And it's important to know that 1 pound equals about 3,500 calories. So you either need to cut 500 to 1,000 calories per day out of your diet, or you need to burn them off through exercise if you intend to lose 1 pound per week. That's just kind of the guideline, and it's just good to know. So other studies have shown that women engaging in aerobic activity or strength training, whoops, lost my place here, have a reduced mortality rate. So that's, you're going to live a longer, healthier life if you begin taking these steps today. So getting started, I would also suggest, if you have no idea what to do and no idea how to get started, the first thing that you can do that's really easy is find an accountability partner. Find a friend or a spouse or somebody in your life who maybe wants to do this with you, because then you're going to have somebody keeping you on track. You can also hire a health coach or a personal trainer for more in-depth consultations. Hiring a nutritional therapist is really great, because talking about supplements, the supplemental industry is like a $100+ billion industry. And I know for me, going into a store to buy supplements, it's like overwhelming. So it's really great to pinpoint and know exactly what you need for your body with regards to supplements, because like Sara said, everybody is different. One person might need one thing and somebody doesn't. So there's no one size fits all. Schedule your exercise in every day. Be gentle with yourself. Take time for self-care also. That's really important as you're going through menopause. And so just to kind of recap, exercise, diet, it's all very important, and it's important to get started as early as possible with that lifestyle. You're going to, when you do, you're going to prevent weight gain. You're going to keep your muscle mass. You're going to reduce that abdominal fat that we get, that visceral fat around our midsection. You're going to reduce your risk of diseases. You're going to keep your bones strong to prevent osteoporosis. and you're going to be in a much better mood because you're releasing endorphins that just make you feel good. So I can't emphasize enough how important it is to incorporate exercise into your daily lifestyle as you're approaching and going through menopause. So,
Julie, what do we have for questions? Unmute.
Sorry, I just did. I do not see any questions coming in quite yet. One that I can ask a question. Can I ask a question?
I see like
I have 2 questions on mine.
Oh, really?
Mhm. I can. One is, this is for Linda Crowell. What age do you need to start bone density testing?
so bone density testing, it would depend. So if you were someone who had like surgical menopause, so had your ovaries removed earlier, you should be starting screening probably around age 50. If you have a family history of low bone density, then starting screening probably around 50, 55 would be a good idea as well. But the general guidelines for menopausal women are starting screening beginning around age 60 to 65. If you had like a history of early fractures, that would be a risk factor. So you'd be starting bone density screening earlier than that.
Also, I would mention that getting a bone density test is very easy.
Yeah.
It's you can get undressed for it. It's a quick.
Right. And it's kind of, again, it's unfortunate that our world revolves around insurance reimbursement. So that's always something to look at too. So to have it done earlier than general guidelines, there has to be a reason why you're doing that earlier. I also wanted to mention, because when we were preparing for this, we were talking about mentioning like the red flags in menopause, which I don't think any of us mentioned. So definitely if you have had 1 year without any vaginal bleeding, so you're like menopausal, and then you start to have bleeding again, you need to let your primary care provider know, because that might be a sign of endometrial cancer. If you are in that perimenopausal phase and you're having like a lot of bleeding, a lot of irregularity, then definitely talking to your primary care provider about investigating that as well. And staying up with your routine screenings, which are your pap smears, your bone density screenings, and your mammograms are important. And I don't know if anybody else wants to add something about like red flags and general screening guidelines.
Well, I see a question about periods, and this kind of does tie in with red flags. So, okay, if I address this. Okay, so the question is, what's the deal with periods getting heavier and more painful? Painful, heavy periods are more common during an anovulatory cycle. So if you do not ovulate, your periods are irregular and heavy and unpredictable, and maybe very, very different from what you're used to for your whole, your whole reproductive career. So it gets a little bit shocking, and it's very it's miserable because you can't really plan on them. They get very irregular. So this is not abnormal. It's really, really common. It's really uncomfortable. I got to say, something that works really well to minimize the amount of blood and discomfort is ibuprofen. Ibuprofen works really well on the uterine lining. So that's a safe and simple treatment. When it becomes abnormal is when it doesn't stop. If you get faint or lightheaded, I mean, women can become quite anemic during this period because anovulatory cycles can mean really flooding periods. So if it doesn't let up with ibuprofen and you're soaking more than a tampon or a pad an hour, you need to call. That would be a marker that is outside the normal range.
Linda, I also see another question that I think might be for you, which is why is sleep harder to come by after menopause? And if anybody has tips for that.
Yeah, sleep health is, we could do a whole program on sleep health, and maybe we should. Number one, okay, and this is a modern phenomenon, it's electronics. Okay, so, or having even a television in your bedroom. All of that needs to go. Because of the hormone fluctuations, you're much more sensitive to stimuli. So having any kind of stimuli around bedtime is going to affect your sleep. At this stage of our lives, often it coincides with having teenage children, aging parents. I mean, there's so many psychosocial issues that go around this time of life that we have to be conscious of what we're doing in the evenings. It's hard to have a consistent bedtime when you have to pick up your kid from track in Orono at midnight. So, I mean, so having a consistent bedtime helps with sleep hygiene. It helps, to go to bed when you feel tired. It's hard to do that socially because of the way our lives are set up. So that is something, if you really cannot sleep, is going to affect your entire life. And that's something you should definitely talk to your provider about. It's easy to start going down the road of taking a sleep aid because it's so debilitating to not sleep. But there are many lifestyle changes you can do to address that before you have to go to sleep aid. I mean, eliminating alcohol helps you sleep better. Mm-hmm. So it really is going to be an individual, one-on-one, let's look at your lifestyle and see what you can do. Increasing exercise helps sleep. Night sweats definitely are a problem with sleep. I mean, they definitely disrupt your sleep, and that they're transient. All of these uncomfortable symptoms are transient. They will go away even with no treatment at all, but that doesn't help you feel better when you're in the middle of it and you're miserable. So anybody else want to pipe in about that?
I will say that also with aging, our sleep patterns do change, and any sleep specialist will say that. We have less natural melatonin. So older people often say, I can go right to sleep and sleep just like totally be unconscious. And then in 4 hours, I'm wide awake. So there are some changes, and they can be irritating because I'm the famous, I can almost, I have an internal little timer. I can wake up anytime between 2:48 and 3:09, almost any night of the week. It is just like clockwork. It's incredible. And I've tried many things. Sometimes I go right back to sleep. Sometimes I need to read. Sometimes that's the time, if you're going to feel anxious, that's a lot of anxiety. When it really peaks, it's dark, there's nothing else to think about but all your fears. Again, steady lifestyle. Our bodies love habitual things. We love habits and good habits. Exercising early in the day, taking a walk, drinking a cup of mint or chamomile tea a couple of hours before you go to bed. Definitely reducing screen time, a big culprit. Doing all those things, and it won't always magically work, but it does help a lot. And that as we get to be, I'm a really old lady, I'm 70 plus, and those are the things that I just sort of have to do all the time.
So here's a question for anyone really. How long do night sweats last? Not each one, but how long do they last in the period of our, menopausal time-ish?
It varies. It varies. Some women have intense night sweats for 6 months. Some women have it for years. It's very individual. I mean, and you can kind of gauge if you take a real good look at your lifestyle, what makes them worse. I mean, red wine definitely makes them worse for some people. Yeah, there's no set there's no set time, unfortunately, but
Yeah.
they do eventually go away. They do wane as you get closer to your last period, and then afterward, it definitely tapers off. So hard to say.
And how about someone's curious about having an IUD and if that diminishes or masks the symptoms of perimenopause?
So
Maybe Linda.
yeah.
Yeah.
So if like so number one, if it's a copper IUD, not that I'm aware of, but if you have like a hormonal IUD like the Mirena, it a lot of times we actually use that as a therapy for women who are perimenopausal with really heavy menses. So it might mask that irregular menstrual cycle. And I don't know, Linda Robinson, like I don't think it really changes a whole lot in regards to like emotional lability, etc. Would you agree with that?
Yeah, it doesn't. It changes the uterine lining, so it does decrease. You know, yeah, because of the progesterone. So it doesn't. So you don't have heavy flooding periods. It'll address that, but mood swings, no.
And how about anxiety, as it can increase during perimenopause and menopause? Is there anything to say about that? Maybe even Sara Tui, do you have some thoughts?
Yeah, I mean, I feel like anxiety and women's health sort of goes hand in hand across across our entire reproductive lifespan. Acupuncture can be incredibly effective for anxiety. I think what can sometimes be even more useful are herbs, just because there are some really fantastic herbs that have don't really interact, as far as we know, with a whole lot of pharmaceuticals. They're very safe long term. One of the nice things about herbs versus anti-anxiety medication is that you can start and stop them sort of at will. So if you're in a period of your life where you have a lot of anxiety, you can you can take an herbal formula for a couple of months. You can alter the dosage as you need it. It's pretty hard to hurt yourself unless you're really taking really substantial quantities of herbs. You can modulate the dosage, and then when you're feeling better, you can just stop taking them and wait a week or two and see how you feel. I don't want to give specific recommendations for herbs, because there's a lot to take into consideration in terms of pharmaceuticals and existing conditions and things like that. But herbs, I think, are a really fantastic option for handling anxiety.
I think part of that question too was about, she said one time I'm feeling okay, and then suddenly I'm screaming at the kids. And that's irritability. And irritability is huge in this time, probably because your sleep is interrupted, you're sweating, you're ripping off your clothes, you just feel kind of uncomfortable. And that causes you to just kind of snap sometimes. And suddenly your sweet children are like little devils. Your partner is the worst person you've ever met. I mean, really, I remember being in perimenopause thinking, it's not them, it's me. I mean, they hadn't changed, but I felt like I was a totally different person. That is a tough one. And again, I think it's this self-care. You got to take a deep breath. You have to say, am I eating correctly? Just part of it is forgiving yourself too, and just knowing that, and looking at things. This is the time when a lot of things happen. Marriages sometimes get on the rocks. Children have problems. You have to you just can't say, oh, it's just me and perimenopause. You have to say, what are the issues within myself and my family and my community that I want to deal with. But it's very difficult. I always say, this is when adulting really hits the tarmac. It's really amazing.
I just want to add to that. One thing that always helps, may not cure it, but always helps, irritability, anxiety, brain fog, all of that is exercise. Even outside in the daylight. I mean, in winter when it's dark, I mean, you know, anxiety is increased in everybody. But if you feel that coming on, it's like, I don't even know why I'm angry now. Put on a jacket and boots and go outside and take a brisk walk. Never hurts, helps your bones, helps your mood, helps everything. So that is what, it's free. That is one thing you can always do.
I agree, Linda. And I think a lot of times women or any person in general feels, when we say you need to exercise, they have in their mind like this giant exercise plan. And really, like I say, it could just be 15 minutes of being outside and increasing your heart rate is better than no minutes, right? Fit it into your schedule somehow. Like as Sheridy said, like it's the pyramid. Put yourself at the top of the pyramid so that you can take care of everyone else kind of in that pyramid. Because if you don't set yourself as a priority, you're going to end up feeling guilty that you're not doing the things that you want to for those around you. So then that just adds another layer of frustration on top of it all.
Can I chime in on that?
Priority.
I'd love to chime in because you use the word guilt.
Yeah.
And it's something in my industry, owning a wellness center, I hear a lot, mostly from women, the guilt associated with taking the time for self-care, because we're so accustomed to putting everybody first, everybody else, and we are last.
Yeah.
So it's just a mindset. That's what I'm talking about, mindset. Switch your mind and let yourself know it's okay. This isn't, you know, a luxury to give yourself time to go for a walk. It's part of your health care. This is your health care, taking care of yourself. So, you know, it's really a mindset, it's a lifestyle, and it's so incredibly important to get that movement in.
So there's a few more questions and we're kind of running into the end of our hour, but I think we all had decided that we could hang on a little after the hour ends. So there's a question about progesterone cream and applying it topically during perimenopause, and if that is a helpful thing for mood swings and irregular periods. Any thoughts on that?
It's very effective for some women, actually. And it can be, we used to have a compound pharmacist here who could make it specifically for tailor it to your symptoms. I don't think there's anyone doing that now, but
I think Portland is the closest place now.
Where is?
Portland.
But for some women, it's extremely effective. And I would like to add there that there's some progesterone and prostaglandins in semen, which is one of the reasons that intercourse, regular intercourse during this period is good. It's good for all your symptoms. But yeah, no, it can be, progesterone cream can be helpful. That is one of the things that's helpful for some women.
And of course, that's if your partner's a male. And then how about brain fog? Any comments on how that's connected to menopause?
I would say that in terms of treating it, the thing that I see that tends to help the most is dietary changes, and really cleaning up diet so that there's a lot of fresh fruits and vegetables and a lot of a lot of really good healthy food that makes you feel good. I think the thing that I find that contributes most to brain fog would be when sort of diet starts to slide. We start eating a lot of refined flours, a lot of gluten, a lot of, and I'm not the kind of person that thinks that gluten is bad, but I just find that when women start to kind of slip into not taking the time to prepare good food for themselves and tending towards more sort of refined carbohydrates, that for me is when I really see brain fog sort of ramp up.
Yes.
I see here hair loss. I just wanted, it's been in the
here. It's a good question.
So I concerned about hair loss. Is there a supplement or nutritional adjustment that I could make to stop this? can I blame it on menopause? Any thoughts, Linda Crowell? Or
Oh, me?
hair loss? Yeah. What?
I mean, we do see hair loss in perimenopause and menopausal women, and it's more so if there's a family history of like male or female pattern hair loss. I mean, I have to be honest and say I don't know a whole lot about herbals or supplements, so maybe Sara would be able to answer that a little bit more. Certainly if there, with examination, if there was concern that it was something a bit more than just like a regular hair loss, like if there is significant alopecia, like a dermatological condition, then we would want to have referral to dermatology. If it seems to be like a female pattern hair loss, then the thing I recommend is Rogaine or using that. But, and I don't know, Sara, if you have any additional information.
I really haven't. I've tried all kinds of things with patients of mine, and I really haven't found anything in terms of herbs, in terms of supplements, in terms of acupuncture that, you know, it's sort of the things that are in my wheelhouse that is consistently helpful. I think nutrition, again, is a place that would be the best place to start to look and to potentially, you know, work with somebody specifically who does nutritional counseling, and that's all they do, just to make sure that you're getting all the nutrients you need to promote healthy hair growth. But I think it's another one of those things that there's no quick fix, and there's no sort of magical turnaround for that.
I would suggest that if you do feel like having significant hair loss, do connect with your healthcare provider, because it can be our skin is like our little signpost for other things going on. So hair loss, when I think about that, I think, is your thyroid working okay? And, you know, are you getting enough protein in your diet? Those are the things that come to mind.
I mean, yeah. It's normal in menopause to have thinning pubic hair and thinning axillary hair. So those two, that's normal.
More chin hair.
What?
But more chin hair.
More chin hair, yeah. Yeah. But yeah, no, if you're losing hair in your head, that needs to be checked out. Yeah. So, and I saw a question about whether this will be able to be viewed. This is being recorded. So we'll have to, how are we gonna?
I think the plan is to have it on either the Women's Health Center Facebook page, or you can access, maybe even call the Women's Health Center to find out about if you're not on Facebook, a way to grab a copy of it. But it will be available. And maybe Carly, if you're there, are you there? Maybe she can answer that.
Hi, yes, we will have this webinar accessible to everyone on the hospital's website.
Great.
Perfect. One last question. What's the best way to increase calcium and vitamin D without using a supplement?
Sunlight. 15 minutes of sun on your face twice a week is the best way in the winter here to get vitamin D without taking supplement.
And there's a couple other questions that I think that are about herbal medications and recommendations and diet and herb support, and wondering if there's going to be a place to look for, you know, ways to find out more. Are we going to have something up for that?
Well, again, I think between Sheridy and Sara, those are two good, especially Sara, who's an herbalist. I think reaching out to people that are experts in this is important to do. There's a lot of supplements and herbal things, you know, we just go on the internet or go to a grocery store and they cost a lot of money. So if you're gonna go for something like that and really want to, you want to know that what you're spending your money on and what you're taking is going to be helpful.
Yeah, I mean, I would just echo Jane that there's a lot of, I think especially in the urban supplement industry, there's a lot of, you know, questionable claims about things. I think you can end up spending a lot of money on herbs and supplements that are not specifically tailored to you. And herbs should not be expensive. You know, it should not be a super expensive endeavor, and it doesn't have to be. And I saw a question here about a good place to find more information on diet and herb support. One of the people that I really like that I've studied with for a long time is Aviva Romm. And Aviva is a midwife and an herbalist, and she's also a Yale trained physician now. She's an MD, and she puts out a huge amount of sort of free blogs and all kinds of different things. So important to remember that, you know, that information should really be tailored to you. But she has a, you know, she's very evidence-based in terms of the way that she looks at things and as a common sense approach to care.
Yes. You're muted, Jane.
I want to thank all of you for attending today, all of you out there. And I want to give a huge thanks to Linda, Sarah, Sheridy, Julie. This is
Carly.
Carly, right. There's so much knowledge and a wealth of information, and that's a great resource for us all. And if you have other questions, feel free to email us or email the Women's Health Center, and we will definitely get back to you. We hope to see you next month, February 24th, when we'll be talking about mind, mental health, emotional issues, and ways to deal with the mental part of menopause, including irritability, anxiety, depression, all sorts of those issues. And then at the end of March, we'll be doing spirit. And I would say that that's sort of looking at this life cycle in the context of ourselves as aging, getting wiser, the changing role in our life, and what that can, the riches that can bring for us. So thanks, everybody.
Thank you.
Thank you.
Keep your face, be well.